Welcome to the Bowringer Academy Parasite webinar series. In today's webinar, we'll be discussing rotten roundworms. So roundworm infections can have serious consequences in both animals and in humans. And so we'll start this webinar by looking in more detail at the problems that they can cause. We'll then move on to the roundworm life cycle, and we'll finish by looking at the advice we can give owners about how to control roundworms. So, what's the big deal about roundworms? Well, roundworms are large, whitish worms that are easy to see with the naked eye. They're several millimetres wide and up to 15 centimetres long, so a bit like a piece of spaghetti. There are several species of roundworms that can infect dogs and cats. There's Toxocara canis, which infects dogs, Toxocara cati, which infects cats, and Toxoscaris leonina, which can affect both, but is less clinically significant than Toxocara species. So in adult dogs and cats, roundworms don't tend to cause significant clinical signs, although you may occasionally see a worm in their faeces or in their vomit if they've just been sick. But in puppies and kittens, roundworm infections are a lot more serious. So they may present being very skinny or with poor growth, and they typically have this pot-bellied appearance. And sometimes they can also present with diarrhea or coughing. And in very severe infections, where there are a lot of worms present in the intestine, they can sometimes cause a blockage, as you can see in the image on the right, and this can be fatal. So importantly, roundworms also pose a major threat to human health, and that's because dog and cat roundworms are zoonotic, meaning that they can be passed from animals to humans. So if a human ingests a roundworm egg, that egg then hatches into a larvae which can travel across the body to the lungs, the liver or other organs, and there they can cause significant disease. And we call these visceral larva migrans. The larvae can also travel to the eyes, which we call ocular larva migrans. And this causes one of the most well-known problems that we associate with Toxocara, which is blindness. We see this most commonly in children, but thankfully it's actually quite rare. So as well as these more well-known problems that we associate with Toxocara, Toxocara also causes a wide range of less obvious clinical signs, and therefore these infections are rarely diagnosed as being due to Toxocara. So studies have shown that people with Toxocara antibodies have twice the likelihood of having epilepsy and are 3 times as likely to have asthma. And Toxocara can also affect learning ability. So exposed children often score lower in maths and reading assessments. These findings have only recently been recognised, and it's led experts to believe that we should be thinking more seriously about the effects that roundworms can have on human health. Let's now move on to the roundworm life cycle. So if we start at the top of this diagram, dogs and cats become infected with roundworm either directly by eating eggs from the environment, or indirectly by eating infected small mammals or by eating undercooked meat. The roundworm eggs then develop into adults which live in the small intestine. And at this point, adult females start producing eggs, up to 200,000 a day. And these eggs are shed in the pet's faeces into the environment where they can survive for years. The eggs are then ingested by a pet or by a small mammal, which is then eaten by a pet, and the whole cycle starts again. Humans can also be infected by these eggs accidentally, either by eating undercooked meat or from a contaminated environment. Roundworms can also be transmitted vertically, i.e. from the mother to puppies and kittens. So in dogs, this can happen before birth via the placenta, and in cats and dogs, this can happen after birth via the milk. So this means that many puppies are born with roundworm infections, and also many puppies and kittens develop roundworm infections in the first few weeks after birth. And this is why worming protocols are so important in puppies and kittens. The pre-patent period of Toxocara canis and Toxocara cati is approximately 1 month. So this is the time from when an animal becomes infected with Toxocara until it starts producing eggs that are detectable in the faeces. So knowing the pre-patent period of Toxocara really helps us to understand how to prevent shedding of eggs, which we'll discuss in more detail later. Roundworm eggs are widespread in the environment as a result of shedding from animals, which is mainly from dogs and cats. And you may be surprised to know that up to 70% of puppies are infected with Toxocara canis. Adult dogs are less likely to shed Toxocara, but because there are more adults in the population and because they produce more faeces, they still account for a significant proportion of the eggs being shed into the environment. In cats, the prevalence of roundworms can be substantially higher than in dogs, especially in hunters that catch infected small mammals and birds. Over 1 in 4 UK cats that go outdoors are infected and shedding Toxocara cati. The most well-known source of Toxocara eggs in the environment are sandpits, and up to 30% of children's public play areas are contaminated with Toxocara eggs. But roundworm eggs are also commonly found in public parks and gardens, and 1 in 5 dogs have eggs on their paws and coat. Exposure in humans is common, and although people of any age can be infected with Toxocara, we see Toxocara infection most commonly in young children, and this is because they're more likely to be exposed to contaminated areas, and they also often have less than ideal hand hygiene. So in a study, 27% of children had Toxocara antibodies. But adults can also become infected with Toxocara, especially the elderly and those with weakened immune systems. So in the same study, 14% of adults had Toxocara antibodies. So what advice can we give owners about how to control roundworms? Well, there are 3 key points that we should be discussing with owners. Why is control needed? The importance of monthly worming, and environmental control. So firstly, why is control needed? Well, if an owner misses a dose, there are often no noticeable consequences for them to see, and so it's easy for them to lapse from their recommended protocols. So to make sure that owners do worm their animals at appropriate intervals, it's really important for them to understand why control is needed. And there are 3 key reasons: to prevent their pet from the ill effects of roundworms, to prevent shedding and therefore protecting themselves and their families, and to reduce environmental contamination. The second important point to discuss is the importance of monthly roundworming. So it's important to note that wormers don't provide ongoing protection. They're usually very effective at killing the worms that are there at that point in time, but within a day or 2, it's possible for the animal to become reinfected. And whilst worming 4 times a year is often recommended, this isn't frequent enough to prevent shedding of roundworm eggs into the environment. And as we've discussed already, to protect owners and their families, it's really important that we prevent shedding. The good news is that we can virtually eliminate shedding of roundworm eggs into the environment by worming pets monthly. As we discussed earlier, The pre-patent period is the time from when an animal becomes infected with Toxocara until Toxocara eggs are detectable in the faeces. And this pre-patent period for Toxocara is 1 month. Therefore, if we kill worms monthly before they start producing eggs, this will reduce or even eliminate shedding. Monthly worming is particularly important in high-risk situations, and this may be if there are children in the household or if the pet has access to the gardens or parks. So in reality, most pets should be wormed monthly against roundworms. There are certain situations where specific roundworm treatment recommendations are required. So with puppies and kittens, they are more likely to be infected with worms, and so it's important to start worming them early, from 2 weeks of age in puppies and from 3 weeks of age in kittens. They should then be wormed every 2 weeks until 2 weeks after weaning, and then every month until they're 6 months old. Pregnant and lactating bitches and lactating queens also need to be wormed regularly to control transmission to puppies and kittens. And as we've already discussed, adult dogs and cats should be wormed monthly to virtually eliminate egg shedding. And lastly, it's important to discuss environmental control, as this will help to reduce the number of eggs entering the environment. So these measures include picking up and disposing of dog faeces, either in the garden or on dog walks, washing your hands regularly, and especially children's hands, covering sandpits when they're not in use, washing fruit and vegetables, and lastly, not putting dog faeces onto composts where the compost may later be used for edible products. Well, hopefully not too many people do this last one. So, in summary, Toxocara is an increasing public health concern and family risk. It's very likely that the human health impacts are substantial and vastly underestimated. It's essential for human health that roundworms are properly controlled in dogs and cats. And we can virtually eliminate dogs and cats shedding eggs by worming them every month. I hope you've enjoyed today's webinar about rotten roundworms, and if you'd like any further information about parasites, please visit the Bowringer Academy at www.bowringer-academy.co.uk.